tonight we are extremely pleased to welcome Dr. Catherine Minto Bain, gynecologist and head of and director of the IVF Center Trinidad and Tobago here, and doing fabulous work on a topic that's very, very important to so many people, individuals, couples, young, not so young, people with the issues relating to their fertility. Good evening, Doctor.
Good evening. Thank you for having me.
So much. Why that our introductory video? Why that?
It's a simple representation of what how fertility works naturally, and actually it's a car advert from Belgium. But in reality, it's actually not quite that simple for a lot of people. So if it was that simple, we would just literally give some Barry White music, some roses, a box of chocolates, and everyone would get pregnant. Mm-hmm. But the reality is that's not the way it is for a lot of couples.
The first slide has to do with what causes infertility.
So anything can cause a problem for a couple to conceive. It can be a problem on the male side. When they put up the slide, you'll see. So that's the center that I run, Trinidad and Tobago IVF. But the next one will show you that really anything can cause infertility. So you've got issues with the woman. It could be something to do with her womb. Tubes are a big problem. They can be blocked or not working. And then you've got the eggs in the ovary. You can have no eggs, poor eggs, eggs not coming out, and we mustn't forget the man, sperm issues and difficulty getting the sperm in the right place, a wide range of issues.
A wide range of issues. And the other slide will show something called very, very common, polycystic disease. Everybody seems to have polycystic ovarian disease.
Incredibly common, and it is something in Trinidad that a lot of people will not have fertility problems from. So polycystic ovary syndrome doesn't always cause fertility. But if there's a problem with very irregular periods, your eggs might not be coming out every month. And that's when we can help. We can help the eggs to come out.
Okay, love. We also know that women, when they're born, they have more than 1 million to 2 million eggs, but there's a rapid decline in the number of eggs available for use during their reproductive years. Tell us about that.
You're right on the ball there. We're born with about 2 million eggs, and by the time we're having regular periods at 15, I don't know if you can see this graph clearly, but there's a massive drop in eggs. Women lose thousands of eggs every day. So by the time you hit 30, you're down to about 5 to 10% of the eggs you were born with. And by 40, it's very hard to get people pregnant. You can see that graph at the end, where it's right down the bottom, that's when you're 45. Regular periods, but there's usually no eggs there. Very difficult to get pregnant.
Okay. And our next slide is going to show, that's a setting that tell us about that. That's where you do your work.
This is just showing one of our clinics. We have 2 clinics, one at Medical Associates, and this is our other clinic in Rookery Nook in Marival. And we're encouraging men to come in and do sperm tests. So the first step really is getting proper, detailed, specialized assessments. And so you come in, we have good facilities, and we do the proper testing to see what the problem is.
Let's talk a bit about this business of sperm tests. A lot of women complain that their husbands, their partners aren't overly willing to have their sperm tested. There's this myth.
A lot of men don't want to come in and do a sperm test, and that's perfectly natural. It's an embarrassing thing to talk about and do, but it's actually very simple. You can produce a sample at home in a pot and bring it into the clinic, or you produce in the clinic itself. And really what we need to know is, do you have sperm there? Are they normal looking? So the count, you need about 20 million per mil. You want at least half to be swimming, and the shapes. How normal the shapes are is important.
Right, and of course, because there are so many millions upon millions of sperm in an ejaculate, there are also many abnormal sperm. Tell us about that as well.
Yeah, 95% of a man's sperm is actually abnormal. So you can see here, the one right on the left-hand side is a beautiful normal sperm, but as you go along, they can have 2 heads, 2 tails. In fact, most of a man's sample is not good quality sperm. And most of the millions you make are never going to get to the egg. It's just the very few good ones that get there.
And always be mindful that out of these millions you need only one aggressive, normal sperm to do the right job.
It's like an army. You have to have your army to get the good one there. Absolutely.
All right, let's see what
So I hope you can see this one. This is what sperm, when you ejaculate, the sperm moves slowly, sluggishly. This actually is a video, so if we click on it, it might start to move. And this is what sperm looks like. This is in our laboratory at Trinidad IVF. And what you can see is there's a lot of rubbish in a semen sample. And so one of the treatments we do is a simple thing called inseminations, putting sperm through the cervix up inside the womb. And once you've cleared them up and prepared the sperm, this is the treatment we do, the sperms are much cleaner, swim much faster, and you can do simple treatments to help people get pregnant if they have enough sperm and the eggs are good.
Okay, well, hopefully we'll come back later on in our program. We'll get to see the sperms moving before they are prepared
And
so
after.
that insemination can take place. There's something called IUI. What is IUI?
It's a simple treatment, insemination. It means intrauterine insemination. It basically means that you can get many more millions of sperms up inside the womb than could get there naturally, so that you get more sperms nearer to the egg, but they still have to get through the tube and find the egg and get inside the egg. So it's one of the simpler, cheaper treatments, and a lot of our couples get pregnancies that way.
Okay, you have one on donor sperm. Donor sperm, that's not a new topic, but it's still relatively new here in Trinidad and Tobago.
It's actually not new in Trinidad and Tobago. I mean, the clinic I run has been here for 17 years, and we've been doing donor sperm. We were the first in the Caribbean to do donor sperm treatment 15 years ago, and we actually have a donor sperm bank here. So a lot of couples don't have any sperm. The man might have no sperm at all, and then you're looking at donor sperm. Single women are, same-sex couples, and sometimes couples where he's got very, very low sperm and can't afford the treatment to put his sperm inside the egg.
So in that case, what about the availability of men who would provide the sperm for these special cases?
So we advertise and recruit both men who can donate sperm, and you can see one of our sperm donor ads here. They're quite tongue-in-cheek, sperm donation. We know you have it in you. We ran a whole series of ads last year. So we recruit sperm donors, and we also, because there's not enough in Trinidad and Tobago, we bring in a lot of sperm from the US that we use here. And we recruit egg donors as well, women who are willing to donate eggs for Trinidadian couples where the woman has no eggs or can't get pregnant.
How much information is available to the general public? We know for the people who are really anxious to have a baby, they go to any length to conceive. I mean, people would invest their life savings, mortgage their home, do all kinds of things so that they can have a. But how much for the general public? How much information is available to the man and woman on the streets about this particular problem?
There's a lot of information on the internet, but not all of it is necessarily good. So we provide free nurse appointments to anyone who wants to come to the clinic. And one of the things, when we were accredited 2 years ago, the people that came from the UK said they think we have some of the best information sheets they've ever seen. So we provide masses of information. Come in and meet with one of the nurses. You don't need to spend any money. A lot of people want to get an idea, what am I getting into? What might it involve? What sort of costs am I looking at? And so there's lots of information available.
Tell us what IVF and sperm injection is.
So if you have a very low sperm count, the sperm, even if we do insemination, they're never going to get inside the egg. So we can take an egg out of a woman's body and inject a sperm inside the egg, and that's IVF treatment. Or if the woman's tubes are blocked, we can bypass her tubes by taking the eggs out. So this is a human egg here in the middle of the slide. They're actually tiny and microscopic, but we magnify them. This is 400 times magnified, and the little tip of a needle coming in on the far right of your screen, that's got a sperm in it, and it's going to inject a sperm into the inside of the egg. Because if a sperm can't get in on its own, we can inject it in and fertilize that egg now. And that's been done in Trinidad. We started that 14 years ago. Again, we've always led the way in the Caribbean. We had the first, so it's called ICSI, into the cell sperm injection. It's a very, very good, good technique around the world. We've been doing it for many years.
And how successful have we? Know you've been doing this for several years, but what is the success rate? I mean, people will be anxious.
Success rate. So when you do sperm injection, usually about 65 to 70% of your eggs are going to fertilize. And then your chance of a baby, really, it's not necessarily the sperm, it's more the egg and the age of the woman. You can do some amazing things these days, not just injecting a sperm into an egg, but you can take an embryo, and you'll see here there's a little ball of cells. That's what we all started at. That's 8 cells, and you and I are billions of cells. And you can actually, there's a laser coming in from the right-hand side, making a tiny hole, a little shell in this embryo. And this, you could fit 400 of these on the tip of a pin, then you understand how small they are. You can take a cell out and check it for genetic diseases.
Now, this little child looking at home and said, "Mommy, what is an embryo?"
It's the tiniest part of human life. It's when an egg and sperm have met, they create an embryo that then implants inside the lining of the womb to become a baby. It's a tiny little ball of cells.
Tiny little ball of cells. And that comes about as a result of the unification of the sperm and the egg.
Yeah.
And our last slide we're going to look at for this segment has to do with adhesions.
Yeah, so other things can be causing a couple not to get pregnant. Sometimes a woman has scar tissue on the outside of her tubes, so the tube can't catch the egg. And so sometimes the treatments we might be talking about are actually surgical. Keyhole surgery, removing scar tissue. There's a whole range of treatments that actually can help a couple conceive.
Take us through what happens after that.
So at Trinidad IVF, we make sure all women firstly get a blood test to see how many eggs they have, and we screen the sperm. They have to do a sperm test in our laboratory because our main problem is sperm tests done elsewhere are not very good quality. And then you get a full assessment. You have to be examined, you have to see a fertility doctor, and basically we go through all your options. What is stopping you from getting pregnant? What options might get you pregnant? What will never work? What are your success rates? What are the costs? What are you really getting into? And we give each couple an honest appraisal of what their options are.
So if a couple comes in with very, very low chance of ever conceiving, they're told up front, listen, it doesn't make much sense for you to put yourself and your spouse or your partner through all this aggravation. And more importantly, there's a cost attached to this.
Absolutely. People, if you're looking at IVF treatment, now IVF can cost 5,000 TT if you're a young, healthy woman willing to share some eggs, but it can cost up to 70,000 TT for older couples. If your success rate is 1 in 100, you need to know that before you sell your car or mortgage your house. You have to be honest and fair to people and be very upfront. Who has a good chance, who has an average chance, and talk to people honestly if they have a low chance.
And do you accept, anybody who comes into the center is accepted, I mean, at least for preliminary investigation? You never make any decisions early?
We're accredited in the UK at Trinidad IVF, so we have to be careful. We have to fulfill European regulations. So if you've got, we do screen people to make sure they have no criminal convictions for child abuse. We have to make sure that any child we create is going into a healthy home, and we have age restrictions. So we have a certain age above which we won't treat people because you have to be able to be there for your child's until they get to maturity 18. We wouldn't treat a 70-year-old woman to get her pregnant, obviously, and then leave an orphan somewhere to be brought up by the state. You have to be responsible and ethical about what you do. And
do you meet a lot of resistance from couples or some people are insisting we want to have a baby at any cost? Do you oftentimes get something?
No, people in Trinidad and Tobago, when they come to the clinic, they're well informed once they've been through the clinic and had all the information, and they're very happy that they've been given all their options. And generally people are just relieved to know what the problem is, what their options are, and they make their choices from there, but very little resistance. People just need information and good assessments and specialist advice.
And when the pregnancy does eventually ensue, what do you do a special thing, or you go through the essentially normal channels of caring for the pregnant lady?
Once your pregnancy is there, it's like any other pregnancy usually, and we do the first pregnancy scan and then very sadly say goodbye to people. And that's the hardest thing for me. I love getting people pregnant, but I no longer deliver babies. It's just you cannot, if you're running a busy fertility clinic, you can't do the deliveries. So we do the first scan, make sure all is set in place, and then we stay in touch with people and we see the babies when they're born.
But there's no obstetrician attached to you?
No, we refer, well, there are many good obstetricians in Trinidad and Tobago, so we find out who people are going to and just get the right information through to their obstetrician.
Okay, and there's of course good relationship between you and the obstetrician because you need to monitor and see the good successes that you'd have had.
And we need to monitor how many boys are being born, how many girls, birth weights, keeping an eye on abnormality rates. You should be having the normal rate for abnormalities that your country has. So we have to collect all our data and provide all our data to our accreditors in the UK. So you're careful and follow up.
And what about the incidence of twin or multiple births?
So that's one of the places where we were really celebrated in the UK recently, because our multiple pregnancy rate is one of the lowest, even if you look at the London clinics in the UK, and it's certainly by far the lowest in the region in the Caribbean. And you would lose your license to practice in the UK if your multiple pregnancy rate is too high, because these babies struggle and have lots of abnormalities generally. Also,
so there's a higher incidence of abnormalities when there are multiple births.
If you're a multiple pregnancy, firstly your miscarriage rate is 7 times higher. But your chance of losing a baby or having a disabled or handicapped baby or a baby with an intellectual impairment or a problem in pregnancy, all of these things are much higher. So we shouldn't be creating multiples, and we don't in our clinic. Our rates are very low.